My name is Agnes Henderson and this is my son Robert Henderson. I didn't actually discover there was a problem with Robert until he was 3 months old, and then I discovered he had special needs. I am his full-time carer as well as his mother, and he needs full-time 24-hour care. He just gets on with life really. He's on various medications for epilepsy. I have open access at the Children's Assessment Unit at the Victoria Hospital in Blackpool. That has been an absolute godsend to us. Basically, I just pick up the phone, say Robert's name, bring him up. Any issues at all, bring him up, we'll deal with it, we'll sort it out. The staff up there are amazing. They all know Robert so well. When I first went into the Child Assessment Unit for the first time with Robert, I didn't quite know what to expect because obviously I didn't expect Robert to have the problems he has. The staff were very welcoming to me. I felt very strange. I was in a strange environment. Robert's my first and only child. They put me at ease. They explained to me what they were going to be doing with Robert at that particular point, at that particular time, and they told me all the way through as to what was going to be going on, blood tests, things like that. Very courteous, looking after me as well, asking me if I wanted a drink or anything like that, taking me into account as well as Robert, appreciating that this is stressful when you're up there. And the kindness that they show towards Robert, even though Robert can't communicate with them, they treat him as an individual, no different from any other child. And that meant a lot to me. You don't get left in a room. They come and inform you as to what's going on. And they're just lovely people, really, really nice. You have to take into account that when you go up there, there's other things happening. They're dealing with, you know, you can go up there and it's dead, and then the next minute you go up there and it's packed. So you've just got to take that into account. They do the best they can, and they always apologise. They're always very apologetic if they've kept me waiting or anything like that. If they can get me out with Robert sooner, they will do it. If he ever has to go into the children's ward down the corridor, the staff there, if you have to stay overnight with them, they try to make sure that Robert is comfortable and that I'm comfortable. And if we have to stay over, things like that, to be honest with you, I think what they do at the moment, I can't think of anything at this present time that would need to be improved. I'm quite happy with the way they deal with Robert. I would just like to say that having open access to the CAU is a godsend. I can pick up the phone and they'll say, just bring him up. And I know when I go up there, I'm going to get the best service that they can offer. And they're just so, it's almost like a personal approach. And also, if the paramedics have had to be called at the school, if he's came out of his fit, they will allow him to just go straight to the unit because they know him so well. To me, I feel they give first-class treatment to Robert, don't they?